Hi everyone. I'll be talking about the health coverage in China. Um, there's a belief that every citizen deserves basic health care. The central government in China is responsible for national health legislation, policy, and administration, and local governments organize and provide such services. China's healthcare system is free. It provides basic coverage for most of the native population, and depending on the region, different coverage is offered. So, how does health insurance work in China? There's coverage for urban employees, coverage for urban residents, and there's coverage for people who live out of town. Universal healthcare coverage was achieved in 2011 through three public insurance programs: the Urban Employee Basic Medical Insurance, the Voluntary Newly Cooperative Medical Scheme, and the Voluntary Urban Resident Basic Medical Insurance. Um, So, how does private health insurance work in China? It's affordable to higher income individuals. It's purchased by employers for their employees. Private insurance can be used to cover deductibles, co-payments, and other cost sharing, and provide coverage for expensive services not paid for by public insurance. The Medical Financial Assistance Program is funded by local government and donations. The program is mainly for people who are not able to afford individual premiums for publicly financed health insurance or pay out of pocket, and provides coverage of emergency department costs and other expenses. In 2018, there were 76.7 million people who were under this program, and that's approximately 5.5% of the population. What are some of the weaknesses of the healthcare system in China? There are severe disparities in the accessibility and quality of healthcare because there's a variation in insurance benefit package. Um, Urban areas have better hospitals and qualified staff. Village doctors lack proper education and they're undertrained. In urban areas, people usually have good access to public and private hospitals, but medical services are limited in rural parts of the country. Healthcare services are better in hospitals rather than local clinics. Health expenditures have gone up significantly in recent decades because of health insurance reform, an aging population, economic development, and health technology advances. Um, What are some of the advantages? Before the reform, most of the people they did not have health insurance. Health coverage through publicly financed insurance is now nearly universal, and there are safety nets for the poor. Income-related disparities have been reduced greatly, but they still exist. There's lower maternal mortality rates, and the life expectancy improved. So now I'm going to talk about China and the US and compare the two healthcare systems. In China and US, both countries provide healthcare, but it's not universal. In China, funding for hospitals and physician salary varies. Imported drugs are more expensive than in the US. In China, physicians' pay is lower than in the United States. Doctors in China will see many more patients than doctors in the United States. In the ER, the US will provide care to patients regardless if the patient has insurance. In China, patients have to pay first before being seen by a physician. So, thank you for listening.